It requires relentless efforts and persistent determination to shred the shackles and transform dreams into reality. Every extraordinary feat, every exceptional accomplishment begins with one single step of hope, courage, and commitment. This is the story of one such person who has made India proud in the field of medical science on the global scale. Dr. Lokeswara Rao Sajja is a senior consultant cardiothoracic surgeon, an innovator, a research scholar, and a compassionate human being. Born into a middle-class family in the year 1956, he was a diligent student right from childhood with great affection towards education. Dr. Sajja hails from a small village, Jandrapet of Chirala Mandal in Andhra Pradesh. He did his basic medical education MBBS from Guntur Medical College and MS from Jipmer, Pondicherry. Later, he went on to do his super specialization in Cardiothoracic and Vascular Surgery at the All India Institute of Medical Sciences, New Delhi, the premier institute of medical education in India. He obtained advanced training under the world-renowned cardiac surgeon, Professor Denton A. Cooley at the Texas Heart Institute in United States of America. Professor Cooley was the pioneer in cardiovascular surgery who has performed over 120,000 open heart surgeries across the globe. At a very young age, Dr. Sajja was conferred with the Fellowship of American College of Surgeons, Chicago, USA in thoracic surgery in the year 1997. With over 3 decades of expertise and clinical excellence, Dr. Sajja has been associated with more than 14,000 open heart operations as a participant surgeon. Innovation is another facet of his many talents. He is the first ever surgeon to design a mechanical prosthetic heart valve that doesn't require medicines for the prevention of blood clotting. He has also designed and patented a device called Mammary Artery Support Platform to ease and thereby popularize beta usage in CABG surgery. This was nominated for the Techno College Innovation Award of European Association for Cardiothoracic Surgery. For his impeccable contributions in the field of medicine, he was conferred with AP Scientist Award for the year 2007. He is the only faculty from India who was involved in developing consensus statement on cardiac and vascular surgery associated acute kidney injury published in JAHA 2018. In May 2013, Dr. Sajja was elected as an active member in the American Association for Thoracic Surgery AATS for his proven record of distinction within the international cardiothoracic surgical field and meritorious contributions to the extant knowledge base about cardiothoracic disease and its surgical treatment. He is the 4th cardiac surgeon from India to reach this milestone since its inception in the year 1917. He is a guest reviewer for the Annals of Thoracic Surgery, European Journal of Cardiothoracic Surgery, Asian Cardiovascular and Thoracic Annals, International Journal of Surgery, Cardiology, Indian Heart Journal, and IJT-CVS. As on date, he has reviewed over 275 manuscripts. Currently, he is a section editor of Indian Journal of Thoracic and Cardiovascular Surgery. He is the first surgeon from India who has presented a paper at the annual meeting of prestigious AATS. He was named as the C.S. Sadasivan Orator of the Year 2014 by Indian Association of Cardiovascular Thoracic Surgeons. He has also presented the results of the first Indian randomized controlled trial in cardiac surgery at the AATS annual meeting held in 2018 in San Diego, California. Currently, Dr. Sajja holds the position of Senior Consultant Surgeon in the Department of Cardiothoracic Surgery and the Director of Cardiovascular Surgical Research at Star Hospitals, Hyderabad. Few of his prestigious achievements. He was invited as a faculty for AATS 99th annual meeting, which was held in Toronto in 2019. Awarded with Best Teaching Faculty for the year 2018-2019 in Cardiothoracic Surgery. Honored with Eminent DNB Teacher in Cardiothoracic Surgery by the Association of National Board of Accredited Institutions of Andhra Pradesh and Telangana in 2019. He conducted the first Indian multi-centric trial in coronary artery bypass surgery and presented at AATS annual meeting in the year 2018 held in San Diego. Conducted the first Indian survey on use of bilateral internal mammary artery grafting during CABG in India. He is the first Indian to present a paper on a study conducted in India at the annual meeting of American Association for Thoracic Surgery since its inception in the year 1917. He has presented a paper titled Coronary Artery Bypass Grafting with or without Cardiopulmonary Bypass in Patients with Preoperative Non-Dialysis Dependent Renal Insufficiency, a randomized study, at the 86th annual meeting of American Association for Thoracic Surgery held at Philadelphia in 2006. He introduced for the first time a new technique of extrafacial harvesting of radial artery graft for CABG in the year 2000. He is the only Indian who presented papers of original research at the second International Workshop on Arterial Conduits for Myocardial Revascularization held at Rome, Italy in 2003. For the first time, he clinically introduced the concept of retrograde coronary sinus perfusion in patients with severe left main coronary artery stenosis. He has published about 60 original peer-reviewed articles as the first author in the leading journals of cardiothoracic surgery. He has presented 23 papers of original research at international fora. Dr. Sajja's commitment towards the customized research in cardiovascular diseases to suit the needs of Indian population inspired him to establish Sajja Heart Foundation in the year 2013. The foundation is an independent, academically focused charitable trust dedicated to improve the survival and quality of life of people with heart disease. It enables the doctors to perform clinical and basic science research in cardiovascular diseases. The mission of the foundation is to create opportunities for the development of basic and advanced research in the field of medicine, science and technology, which will have a beneficial impact on society. Sajja Heart Foundation aims to promote quality research and publications, particularly in the fields of cardiology, cardiovascular surgery and medicine from India. We encourage and empower our members for the development and adoption of cost-effective technology and treatment modalities. We aspire to aid the researchers and investigators in designing studies, data harvesting and analysis, manuscript preparation, which leads to quality publications. On the occasion of Professor Denton A. Cooley's 100th birth anniversary, every year, Sajja Heart Foundation organizes their annual meeting on 22nd August to commemorate his contributions and share valuable clinical insights amongst the members. Be it for the noble initiative of the Heart Foundation or the years of research for the well-being of people and society, Dr. Lokeswara Rao Sajja has been a perennial source of inspiration for numerous aspiring individuals. His contributions to the field of cardiac surgery have brought in incredible recognition for India on the international platform. He has proved on numerous occasions that it is dedication and hard work which can make anything possible.
Lokeswara Rao के लिए Senior Consultant, Cardiothoracic Surgeon and Director of Research at Star Hospital, Hyderabad and Chairman of the Sajja Heart Foundation. He completed advanced cardiovascular training at the Texas Heart Institute under Professor Denton Cooley. He's authored over 115 articles in peer-reviewed journals and leads pioneering research like the Promote Patency Study and the Predict Study. Congratulations, Dr. Lokeswara Rao.
Dr. Sajja served as the president of IACTS and presented at the 10th International Coronary Congress. The 10th annual meeting of the Sajja Heart Foundation was also celebrated, marking a decade of impactful contributions to cardiovascular care.